It is every parent's worst nightmare to watch as their newborn is sent to the neonatal intensive care unit. Even more so, waiting in agony as their unstable baby undergoes a series of invasive procedures, one of which is a blood test from a heel prick that detects upwards of 20 serious conditions. We will reduce the need for additional tests with our non-invasive continuous monitoring device that reveals significant changes in the patient's glucose and lactate levels. While we cannot mitigate the need for newborn testing, we can change the invasive nature of these procedures by removing needles from the equation altogether. Using sweat sampling, our device will stick to the baby's abdomen like a Band-Aid, thus eliminating the trauma caused by the traditional blood screening method. Our technology will accomplish two main things. Firstly, our device will minimize laboratory involvement, allowing hospitals to achieve better outcomes and save money. Secondly, and most importantly, our technology will reduce the psychological and physical toll experienced by both the babies and their parents. We need to raise 1.2 million pounds for clinical trials to demonstrate that our device can produce consistent, accurate, and real-time data for clinicians, hence allowing us to transform infant care and take neonatal diagnostics to the next level. About 1 in 10 of the 3.7 million babies born in the United States have the potential to be relieved from the stress and pain that can accompany blood draws. Let's give families some relief from the fear they experience while their newborn is in intensive care and help them regain joy after the incredible feat that is childbirth. Thank you.
This kind of a regular test after some babies are newly born, like I don't quite get where it's going to be used. When?
So the test that is currently done is a dried blood spot test, and that is performed on all babies, whether they're in the NICU, neonatal intensive care unit, or not. We are introducing this device to be used before that to see if they even need to have this dried blood spot test. In some cases, these tests can render inconclusive, making it so that babies need to have from 15 upwards of 20 tests per baby. So we want to come in and be able to completely get rid of that from happening.
Okay, so basically your target could be every newborn, right?
Yes. So the full market that we're potentially looking at is the 3.7 million babies born in the United States.
I was going to ask you that question.
Yes. And then more specifically right now, we're focusing on the newborns in the NICU, which ranges from about 370,000 to 450,000 per year.
Okay, thanks.
Right. Sweat is an interesting matrix. I mean, what do you think, or what's the variation between what you look for in blood and what you're looking for in sweat, and what's this variation in person or baby to baby sweat of the markers you would be looking for?
Yeah, great question. Since we're still in the process of filing for a patent, I can't get too deep into the technology without a confidentiality, which I'm happy to discuss afterwards. However, I can say the way that we're sampling the sweat and we're monitoring the sweat is completely different from those currently on the market. Currently, devices that use sweat monitoring, you have to get the person running, you have to really get them moving, whereas ours, we can monitor these babies with them being still.
And yes, NICU is not a nice environment, but are there other environments and other applications you see for this? If you have a unique method of monitoring sweat without
Absolutely.
the need to sweat, is there a larger and easier, more kind of probably a lower regulatory barrier available?
Right. So we decided to start with the NICU because these are the patients that would benefit the most from something that would minimize the invasivity of these tests. Like I said, dried blood spot tests can be quite invasive, and our team has been able to go into the NICU to see how distressed these parents and babies are from getting these tests multiple times. However, it is possible to move into other age groups later, potentially focusing on those who may need at-home care and that cannot necessarily be super active to get those data points and measurements.